Thanks, Hannah.
Hello, everybody, and welcome to another session of dental shadowing. Today we have Dr. De Guzman, who is a United States Army dentist as well as a endodontist. So she's going to give us a shadowing session today all about her journey into dentistry as well as her life. She's a mom and she has a pretty cool fitness life as well if you check out her Instagram. But yeah, you can take it away, Doctor.
Okay, thank you. So first of all, welcome to those of you who are watching this live, and welcome if you're watching the recording. And I'd like to say thank you very much to Hannah for facilitating this, and thank you to Dental Shadowing for this amazing opportunity for me to reach out to you and for you to reach out to me and to have another resource to help you in your career goals. So as Hannah mentioned, my name is Dr. Jasmine de Guzman, and I will be sharing a lot of information here, but also the other thing I just really love to do is hear from you, answer your questions. As she mentioned, I'm accessible on Instagram. My handle is dr.jasmine.fit. And that information will be provided to you at the end. So if you ever have any other questions, especially if you're not watching this live, then you can always reach out and let me know how I can help you. So I'm going to advance the slide here. So these are the things that I'm going to cover in this amount of time that we have together. And again, I'm really, more so than just talking about myself, I really am looking forward to helping you specifically with your questions, but I do hope that you'll gather some pearls and some little concepts here and there that are going to help you as you make your way and make your decisions towards your career goals. So as you can see from the outline here, I'm going to cover all of these things. They might not be exactly categorized as such, but what you might notice is that they're kind of all blended together. So just a little introduction about myself here. I am originally from New York. No matter how many times the Army moves, myself and my family, I'm always going to say that I'm from New York. I'm an East Coast person, but I am here in Hawaii right now. So I was born and raised on Long Island. I'm not a city girl. That can be a common misconception. But as you know, New York is a melting pot. And, being in the United States these days, a lot of us are very, a very mixed culture. So my father's originally from the Philippines, and my mother is from Mexico. So they are both immigrants to the United States. Where I grew up in New York is, gosh, I don't even know. It was predominantly Hispanic. I went to the second largest public school in New York State. I had about 900 people graduating in my class. It was just a largely underserved population. So that's just a little bit of background from where I came from. My parents taught us to work hard for what we want and to look for the resources that we need to fuel our passion and to get to where we want to be. I also had very strict parents, so there was also a lot of motivation to move on and become not only independent, but also to be successful. So what I'm going to do is tell you a little bit about my journey. So I did go to Cornell University, which is in upstate New York. It is an Ivy League university, but you do not need to go to an Ivy League fancy tier 1, extremely expensive school to be successful, right? It can help a lot. And if you're still at that stage where you're striving and preparing to go to college, sure, don't limit yourself, apply to these schools, look at what the requirements are, and see if that's something, number one, if it's a school that you want to go to, but number two, if you meet the qualifications, because a lot of times, sometimes we limit ourselves and we think, oh, I can't do that, that's not possible, but, don't limit yourself. But you do get what you pay for. So having said that, my parents didn't have any money for any of my siblings and I to go to school with. So I worked throughout college. I worked 10 to 15 hours a week. I don't recommend it, but that was required of me in order to maintain my scholarships. And also I had plenty of loans. So what I want to say is I started off at school as a pre-med biology major. I thought, okay, I'm going to be a doctor. I want to be a surgeon. I want to work with my hands. And I was just thinking sciences. I thought in order to become a doctor, I needed to have a science background, which is completely untrue. as you may already know, or as you'll come to find as you meet people along your path and you find out, you're like, oh, you had a German major, or oh, you had a political science major, and you're becoming a doctor. These are all very true things. And so it's important for you to find your path and to find out what you are super excited about, what you love, what you're passionate about, and don't limit yourself again, right? So look at the different opportunities. I really was very naive when I went to college. I was 17 years old when I went to college, and I just thought, in high school I had classes that were, you had your science, you had your math, and you had physics and chemistry, biology, but I didn't realize that there's a whole world out there of different majors and things that you can enjoy in your life, right? Because that's 3 or 4 years of undergrad university that is not only it's a stepping stone and a chapter in your life, but you want to have fun. You want to enjoy what you're learning. So I started out, as I mentioned, as a biology major, but I ended up graduating as a pre-dental psychology major. So I'll tell you a little bit more about that. So what happened was, I thought I was so special. I thought I was so smart. I did well when I was in high school. And so I actually tested out of some of the introductory college courses when I got to Cornell. And so it wasn't until my second semester of my first year of college, my freshman year of college, that I was taking biochemistry. I think it was biochemistry, because I had placed out of the introductory one. Well, lo and behold, it kicked my butt, and it was extremely hard. I saw grades on the paper that I had never seen in my life before. I just, I couldn't believe it. And I was really upset because I thought, how am I going to get into medical school? That was, what my career path was at the time. How am I going to get into medical school with these kind of grades? So that's something to recognize, is that you're going to have setbacks. You're going to have experiences where it's not not how you planned it to go, but that's okay. You keep moving, right? So I thought, okay, well, what am I going to do? What happened was I decided, I said, I need to take this class over again, because how am I going to get into medical school with this kind of grade? So after my freshman year, that summer, I went home. I was living in my parents' house, and I decided to take that course again at Stony Brook University, which is on Long Island. And so not only was I taking that class, but also I have a little sister. And the image on the bottom left, that's not her mouth, that's a model, but that's something called a palatal expander. And basically she had a device just like this in her mouth. And every morning she would come to me with this little key, and I would turn the key to, slowly expand that apparatus that would in turn expand her palate. And not only that, but I had a driver's license by then, because when I went to college, I didn't have a driver's license, but I eventually did get one. I took her to her orthodontic appointments regularly. And so one day, the orthodontist turned to me and he said, and so what do you do? And I was so proud. I was there. I was, 18 years old at the time. And I'm like, oh, I'm pre-med. I'm going to go to medical school. I'm a college student. And I was rightfully excited, because this is a really exciting time for you in your life. But the orthodontist just he smiled at me and he goes, don't go to medical school, go to dental school. And, he gave me a couple of sentences as to why he loved dentistry. And I thought, I was like, well, that's really interesting. I never even considered it as a career. And just to backtrack a little bit, I don't have doctors in neither of my parents were in the medical field, but all of my uncles and aunts were doctors and nurses, and even my cousins became doctors. And it was something that I saw as prestigious, not only to help people to be in the healthcare business, but also they seemed to be doing pretty well, and they had money in comparison to my family. And so it's okay. It's okay to want to have money. You want to have a job, a profession that's going to be able to provide for you in the needs and wants of your life, right? You don't need to have a lot of money to be successful or to be happy. And that's another important thing to remember. So anyhow, the image in the middle here, that is a building called Barnes Hall. So that's kind of essentially on the Cornell campus, we had our career center, or kind of like where you would find your guidance counselors. So I took a little test, like a career assessment test, and everything pointed, of course I knew what the answers were, right? Like I knew I wanted to go into medicine, or maybe now I was thinking about dentistry. And so the way that I answered all the questions, it pointed to a career, in medical or dental or in the healthcare profession. And the guidance counselor there looked at my grades and actually discouraged me from applying to schools. They were like, well, I don't know, you don't have really good grades. I suggest you find something else, right? And this is something that maybe some of you may have heard before. And again, you need to not set limitations or let other people set limitations for you. Sure, maybe you don't have the qualifications right now, but it doesn't mean that you can't get to them, right? So I was like, you know what, you have resources, I'm going to use them. So they actually had a little program where I could choose from different alumni to go shadow them. Because I was like, oh man, this person's discouraging me, telling me I can't become a doctor. I was like, shoot, well, maybe, I was like, do I still really want to be a doctor? Let me make sure. So I chose from a few of the alumni and had the opportunity to shadow a medical doctor in a hospital in Boston. And then I think I shadowed a dentist in Connecticut, and I shadowed a dentist in upstate New York called in Binghamton, right? And so from those experiences and having the opportunity to ask those individuals what they liked about their profession, I was able to kind of dig a little bit deeper into myself and kind of decide, you know what, I still want to become a doctor. I still want to work in the healthcare industry. And I'm kind of really liking this idea of dentistry because they only work anywhere from 3 to 5 days a week. Dental emergencies do happen, but it's extremely rare for a patient to die in your chair or in your office. And not that I don't want to be responsible for that, but I don't want to be responsible for that. That's what the medical professionals are for. So, and I still get the opportunity to be a surgeon, to work with my hands. So this was extremely exciting to me. So for those of you who are watching, you are doing absolutely the right thing, right? You make sure you take the opportunity to ask questions, to reach out to individuals who might be in an area or a field or a career that you think you might be interested in, and ask them questions. Ask them, why did you choose this? How did you get to where you are? And what what advice do you have for me if this is something that I'm interested in doing? So you are doing the right thing. So what happened from here after I shadowed these individuals from my university is I had a new drive. I had a new commitment to what my career goals were, and my grades just shot up because I was so excited. And at the time I also switched over from a biology major to psychology major because I also learned that you didn't need to have a science background. And I love biology, but I was really entertained by psychology. So my degree is in psychology. So I was a little bit behind when I transitioned and decided I want to go to dental school. And in order to go to dental school, you're probably familiar with all the requirements. In addition to the core requirements of your science classes and such, you need to take the dental admission test, the DAT. So I needed to prepare for that. I wanted to make sure that I was ready for that. So I actually I guess nowadays you guys call it a gap year. It's very cute. Back then we called it like oh my gosh, I'm not ready yet year. And so I worked in Boston. My sister actually was going through medical school at the same time as I was in undergrad. So I also had the opportunity to watch her go through medical school and help me think about gosh, is that really something that I want to do? I don't know, but she matched in Boston and I had a job opportunity in Boston. So we decided to live together, and I did research at Harvard. And the way that happened though was I was specifically looking for a job opportunity, one, because I needed money, and two, a job that was gonna give me something to say on my application that was somewhat related to how I care about healthcare, or how, as a stepping stone to having a field in that profession. So at Brigham and Women's Hospital, I did research where we tested different types of bone cements, right? So if you think about anybody who's had like a shoulder replacement or a hip replacement or a knee replacement, kind of gruesome, right? But sometimes they cut certain parts off and then they stick pieces in, and they'll attach metal into the human body, and they do it with cement. And so I got to test these cements, and the different types of cells that are in the body interacting with the cement, and which ones were better. So that was just kind of a neat opportunity. And during that time, I also studied for the DAT, right? So I was saving money. I was saving money for the DAT. I was saving money for interviews, because I knew that was going to be an expense. And I did ask for help, if my birthday was coming up or if Christmas was coming up. I, would simply say to my siblings or to my parents, I was like, you know what, if you're thinking of being so kind and thinking about me for Christmas, I could really just use a little contribution towards my study guides, or towards my travels for interviews that I'm anticipating having. So, any means, right? Saving money, and asking for help if it's available to you. There's also scholarships, of course, out there. So me personally, I actually took the Kaplan course to study for the DAT, and I also used Dental Dex. That was kind of a little while ago, so I know you guys have so many resources out there. So make sure you pull your friends, or you reach out and kind of recognize, though, also that what worked for somebody might not be what works for you. Or maybe you are just amazingly talented and incredibly smart, and you don't need those resources. There are those people out there. But for me, I needed every edge. I've always studied hard, and I've been a great student, but sometimes I felt like my grades didn't reflect it. And this was a period of time where I was like, I need every ounce of me to show that I'm dedicated to, doing a good job and getting into dental school. So let's see. Let me go back here. So what I did do, so I took the DATs, and then as far as applying to dental schools, I applied everywhere up and down the East Coast. I'm an East Coast person. I've applied as far as Louisville, Kentucky. I put a little map there because as Americans and me, when I was young, a bit naive or ignorant, I didn't know where Kentucky was. So I kind of had to look at the map and be like, where am I going? So something that I did want to say about this is beggars can't be choosers. Hey, if you've got wonderful grades and you have amazing mentors and people who are going to write you outstanding letters of recommendation, then sure, apply to your favorite 1 or 2 dental schools. Like, if you are in California and you were like dead set on going, I want to go to UOP, or I want to go to Loma Linda, or, any of the, I want to go to Utah, and I only want to go to Utah, I only want to stay in Utah, I want to be in Florida. If you have the ability to do that, good for you, where you can pick and choose, and you can say, I only want to go to this school. For some of us, we're beggars can't be choosers, right? There are these amazing resources. I think it might be this book that I have shown here, where it shows you all of the demographics of the applicants for these schools. So not only will it show you how much the tuition is, which can be important, especially if you don't have any money or savings from your, or from your family, and you're going to pay for this on your own. Every tens of thousands of dollars makes a difference, right? Because you're essentially going to be $500,000 in debt. $500,000 in debt. Just repeating that in case you didn't know. Dental school is very, very expensive, right? And you need to make sure that this is truly what you love. I did have a dental classmate who, after our first year, he left. His father was a dentist, and he was like, I'm going to be a dentist too. I'm going to take over the practice. He was just like, this is not for me. I don't want to do this. So you got to make sure that this is what you want to do. You don't want to incur debt for something that you're not loving and passionate about. So again, going back to this guide, or whatever resources that you want to use, you can look at the demographics, right? Don't apply to a dental school that doesn't accept out-of-state applicants, right? You don't want to waste your $50, or hopefully they would just reject it. But also, you don't want to apply to a school that only accepts 2 out-of-state people, and you are, and you don't belong to that state. So be aware of these things so that you can plan accordingly as to where you want to go. I could have easily extended my search to a little bit further, in around the United States, but I also had limited resources, right? I couldn't just apply to every single school that I wanted because that was additional money. So what I want to say is make sure you're real about your status, right? Are you that confident? Do you have all the money that you need that you could just apply anywhere? Do you have the grades and the scores that you could just apply to one or two schools and be like, I'm going to either this school or that school? If you are, that's good. If not, then plan accordingly, right? But again, you want to be happy. And so that might mean applying to places that you've never even thought about going. Like for me, Louisville, Kentucky. I don't know how that name came about. I even applied to the Ohio State. I had been to Ohio before, but it's not like I was like, this New Yorker wants to go to Ohio. No, I looked at the tuition. I was looking at how much tuition costs. But also, I know that you will get an amazing education no matter what school you go to. You really can't compare them unless you were to go to both schools, which you're, or multiple schools, which you're not. And of course, they have different ways of ranking schools and saying, well, this one's, for example, Columbia in New York City, that one focuses a lot on research. So does Harvard. And something else that sometimes is shown in these books is what percentage of the graduates end up going into specialties, right? End up specializing, whether it's orthodontics, endodontics, oral surgery, periodontics, implantology, those types of things. And that can kind of also give you a little thought of like, oh, well, the majority of these graduates, they end up going on to further school, or, that kind of thing, just being aware. And this information is also going to help you when it comes time for you to interview, right? Because when you interview, you don't want to tell your interviewer when they say, hey, what makes you want to come to Louisville? Like, I don't want to be like, well, your tuition was cheaper. That's not the right answer, and they're not going to like that. So be familiar with the programs, right? So in those guides, it'll tell you some about the curriculum. It'll tell you maybe even about some of the extracurricular activities or some of the specialty like classes that they might have. So again, be real, know where do your research, look into these places and see where you want to apply and what your goals are in terms of whether or not you think you want to. And I know right now you're the first step seems like, well, hi, I just want to get into dental school, or how am I supposed to think about specializing? It's okay, you don't have to make a decision, and you might change your mind like 3 or 4 times about your career, about dentistry, about specializing, but just have it in the back of your mind and know, hey, if I want to specialize later on, I should do as best I can with my schooling, with my grades, and that sort of thing. So okay, so again, I mentioned money. So and I'm excited again to come back to anything that you guys have questions about, just kind of getting closer to where I am now in my journey. So as I mentioned, I did not have money growing up. My parents didn't have money for us growing up. And actually, my parents discouraged me from applying to dental school because they said, well, look at your sister. She's in debt for going to medical school. She has lots of debt, and yes, she's going to pay it off, but it's going to take a lifetime. And, we've always been of the type where we'll figure it out. So I'll figure it out. I interviewed at all the dental schools in Boston. I was living there at the time. And when I interviewed at Tufts University, after they give you so I think the way that they do it is, I can't remember if they interview you first and kind of get your jitters out of the way, and then tour you around the school, and then give you a little opportunity to meet and greet with the students. This is pretty standard of schools. They might do it in a little bit different order. But then at the end of the session, they had an information session. And so they kind of went over all the numbers, told us how much tuition costs, how much your books and instruments cost, how much your healthcare is going to cost. There are some schools out there who require you to have healthcare insurance, maybe even all of them, which is a good thing. You should have insurance. And so after they dropped this information, then they they said, oh, by the way, we have some special guests to come and talk to you. So in walked in the Army, the Air Force, and the Navy recruiters. And it's the same scholarship that they were offering. They basically said, hey, we have a scholarship. It's called the Health Professions Scholarship Program, HPSP. It pays for everything. And, you know, they kind of gave a little spiel, and then they said, who wants an application? And I'm like, I got an application from everybody, because at the time I was like, I knew nothing about the military. I just knew I needed money. I needed a way to fund my, you know, my education, and to even explore whether or not this was of interest to me. You know, you always have the opportunity to say no later on, but when someone is telling me, hey, there's a scholarship opportunity and we pay for everything, I wanted to jump on board with that. It just so happens that for me, in my situation, the Army recruiter was the most attentive to me. Like, I had these applications and I couldn't even read them. I didn't understand some of the terminology, like the lingo, the military lingo. And so I was making phone calls, and the Army recruiter was like, I'll be right there, ma'am. So that's how I ended up in the Army. But the different branches do have their pros and their cons. But the Army, you know, has been wonderful for me personally. And as you can see, I've always been really excited about helping others. And I guess I've just always come across as being friendly and bubbly and extremely passionate about what I do. So they did end up asking me to do a recruiting photo shoot. And so my pictures were circulating in magazines and stuff. And yeah, it's just fun. I don't get any money for it. If I say anything here, it's not affiliated with the Army. These are all my own thoughts. I'm not recruiting. I'm just sharing information for you, because if you're wondering how you're going to pay $300,000 or $400,000 or $500,000 for dental school, just know that this is an option. But also know that the majority of your friends will take loans out. That's how most people do it. If they don't have someone who will outright write a check. I had a girlfriend in dental school whose parents paid. She would write a check every quarter, you know, every semester for school. Good for those people who can do that. I didn't have that kind of money. So let's see. So I did end up going to the University of Pittsburgh School of Dental Medicine, right, in Pittsburgh. I was happy to go there. I actually wanted to go to Temple. It's okay. It's okay to want to go places. I went to Cornell. I wanted to go to Brown University. These things happen, right? You know that you're going to have experiences where you don't get what you want. My husband says to me all the time, he's like, you know, you can't always get what you want. He goes, I know you're used to getting what you want, but you can't always get what you want. This is true. And know that there's always a reason for everything, right? When they always say, when one door closes, another door opens. To be honest, I just was so grateful to go to dental school. It was just a dream that I'd be like, hey, I'd really like to go to Temple. Again, if you can do that, if you can choose, like, you know, be picky and choose the school that you want to go to, then that's wonderful. I had an amazing experience at the University of Pittsburgh. The dental school size was really impressive. I say impressive. What I mean is it was very, very well balanced. You know, I interviewed at NYU. I'm not down on anybody who decides to go to NYU or who did go to NYU, but the class size is extremely huge. I'm not a city girl. That's another thing. I don't know how to hail a cab. And also the attrition rate is high. So that's something else that you want to look at if you might struggle academically, right? So what that means is, for example, if let's say NYU, I'm just making things up right now. If they accept 100 students for their dental class, let's say for their freshman dental class, they have a high attrition rate, meaning they only have 80 chairs for when you go from didactics to your clinicals or your preclinicals or your clinicals. So that means that the 20 bottom people of the class are going to get cut, right? So if you have a couple $100,000 to throw in the garbage, that could be okay. And I'm not saying that I was the worst student ever, but just the idea of knowing that you're going to start with a class size of such, you know, of this many people, but when you graduate, it's only going to be this many people. And they know that because they're not going to continue on that many people because they don't have enough chairs for the many students. So that was just something that I was not interested in. I wanted to go to a school that was gonna, that didn't have a high attrition rate, meaning that, most people who start will graduate. They also had a really cool ratio of male to female, and Pittsburgh was a really fun city. So during that time, you guys have the best years of your life are all ahead of you, right? I mean, you're gonna have ups and downs along the way, but you're gonna have so many different exciting opportunities and challenges, and it's just gonna be, dental school is a little bit different in that you guys are all taking the same exact classes at the same exact time. In comparison to when you go to university or college, where you pick and choose what classes you want, with the exception of a few electives that might happen in dental school later on. You're all in the same class. You're all taking the same lectures. You all have the same exams at the same time. It's really kind of a fun community. And for me personally, I also had no dental experience. So, there are going to be some individuals who have had experience, like their parents are a dentist, or their aunt or uncle, they have someone in their family. I had nobody. So I was ground zero, like they're like, oh, step on the rheostat. And I'm like, I don't know what a rheostat is. And they're like, oh, that's the foot pedal, the pedal that powers your thing. I'm like, oh, okay, I didn't even know. But know that you'll have an amazing experience anywhere you go, or make up your mind to decide that you're going to have an amazing experience no matter where you go. So then kind of stepping forward into where I am now as a dental professional. I graduated from the University of Pittsburgh. I actually, my husband and we met as freshmen at Cornell. So we were both 17. So he's my college sweetheart. I mean, essentially you could almost say high school sweetheart, because, we were 17 when we met, but, I did get married during dental school. So my parents were not supportive of me going into dental school because they were worried about the debt that I was going to incur. So they certainly weren't supportive of me when I wanted to get married during dental school. But we were not going to, I was like, I'm not going to wait 4 years to get married. My life is happening and there's just exciting things going on. So we got married in between our first and second year of dental school. And then, as if life wasn't hard enough, I had my first kid in between third and fourth years of dental school. Still graduated on time, still got licensed and all that good stuff. And it's just a matter of working hard and just kind of rolling with things. Because for any of you who have little siblings out there, or if you have nieces and nephews, then I didn't know. I thought the baby slept all the time. I was like, oh, I hear that newborns sleep all the time. I'll just study for my boards while the baby's sleeping. So I spent a lot of times crying, a lot of times, pumping milk for this baby and breastfeeding and all that stuff. But I wouldn't have it any other way. It just depends on how exciting or how challenging you want to make your life be. But know that anything is possible. You can do things any way you want. So, okay, getting on to where we are now. I know this says military dentistry. Not all of you are going to go into military dentistry, but I just want to share a little bit about the experience. So you are here because you want to be a healthcare or dental healthcare provider, right? You want to take care of people. That's wonderful. So when you graduate from dental school, or as you prepare to graduate from dental school, you're going to go, I need a job to pay for all these loans, or I want to move on to the next step of life. And actually, just a little side comment about that, enjoy the journey. And I'll say this again towards the end. Enjoy your journey. Sometimes we kind of think, or at least I thought at the time, I was like, okay, my life will start when I get into dental school. I'm like, okay, my life will start when I graduate from dental school. Okay, my life will start when no, your life is happening, and this is so exciting. Just really try and find what brings you happiness, what brings you joy, and enjoy the journey. And again, these bumps and obstacles, they're going to happen. They're going to happen. And it just depends on what kind of mindset you have to manage them. But a little bit about me. So I graduated dental school, and I owed the Army 4 years as a general dentist. And you will hear people say this over and over again. It goes by so fast. Dental school goes by so fast. Undergrad goes by so fast. It truly does, right? And so I had a little bit of that perspective. And that's why when I signed up to be in the military, so that they would pay for everything and give me a stipend, that's another thing. So not only do they pay for everything, but they give you money to live, to pay your rent, to buy your food and stuff like that. That's why when they said, okay, we pay for your 4 years of dental school, you pay back in 4 years of service as a general dentist, I was like, sounds fair to me. I don't think I could make that kind of money in 4 years right after dental school to pay off all those loans. And actually that goes to, I just wanted to say something about, I know I use this as an example. I didn't want to go to school in New York City because not only is the tuition expensive, but the cost of living was extremely expensive. So I have friends who also had the same scholarship as me, but they still came out with a little bit of debt because they needed money to live, right? You need money to pay for your cell phone, and you need money to buy food with, right? So even though the Army was giving them money, the cost of living was just so high that they still had to take out loans, and it happens. Loans are not the worst thing in the world. Us as Americans, we're very familiar with this concept of having to borrow money to fund our education. So I did work as a general dentist for a couple of years, and during that time, I was still trying to decide: do I like the Army? Do I want to specialize? And so I had the opportunity to shadow. So it's shadow again, right? So this is happening all throughout your life. When you find people that you admire, with careers that you admire, or a lifestyle that you admire, feel free to reach out to them, pick their brains, especially if it's someone that you jive with well. Be friends with them, or if they're older than you, ask them to mentor you. And so I had the chance to go around through the different specialties again, right? Because of course in dental school, you're gonna become licensed to practice dentistry in all the disciplines, right? Yes, you will be able to do not only fillings, you'll be able to do extractions. You can do all these things, but for me personally, it's kind of fun to be really good at one thing, because I actually find general dentistry really hard. It's really hard to be really good at doing crowns and taking out teeth, and really good at making bridges and dentures. People do it all the time. That's wonderful. But for me, I wanted to focus on one thing in particular. So I ended up going into endodontics, right? So if anybody's not familiar, I didn't share too many images here of root canals, because I know that you guys can look at all that stuff up on the internet and see lots of cool pictures. But what I do want to just tell you about endo. So basically we deal with pain management and saving teeth. That is what we're all about in this specialty of endodontics. And I think it's really cool because we're essentially the last resort before someone has to consider taking a tooth out. Excuse me. So basically what we do is we go inside of the tooth and remove any irritants or infection from inside the tooth. We call it, like, we devitalize the tooth, right? We take out any nerve tissue or infected tissues from in there, clean and disinfect, and we put a filling material in there, and then we seal it all up. And then usually the general dentist will put a crown, or the layman's term for it is a cap, on top of the tooth, right? And again, we do this to eliminate or prevent pain and infection, and help the patient keep the tooth for as long as possible. The alternative treatment would be to take the tooth out. So like I said, that's kind of where endodontics sits. The other thing is that sometimes when this treatment modality doesn't work, like we call that non-surgical root canal therapy. If that's not effective, then we resort to surgery. So the image on the left is a picture of me doing a surgical procedure, and that's essentially where we're not going inside the tooth anymore. We've already done that. Now we're coming externally through the bone, removing an infection that way, and then closing it up and letting it heal that way. So that's endodontics. Something that's kind of neat as a military dentist is that I get phone calls from our military veterinarians asking for us to do root canals. So these are military working dogs usually, right? These are our bomb sniffing dogs. They are very special to us. And for those of you who have pets, I don't have any pets. I have children, but I know how special animals can be, and these are really important in saving lives. They're highly trained, and of course, a human's life and a dog's life are they're both important, but we do send out our military working dogs to do some of the hard work that, you know, that we can't do to kind of secure perimeters and that sort of thing. So let me backtrack a little bit. So general dentistry is great, but if you want to specialize, then you know, shadow someone who is, you know, either in the specialty that you want to explore, or shadow multiple people to kind of get a feel for it. I've never been interested in periodontics, right? That's the gum and bones. I do surgical procedures, and yes, sometimes I can smell blood, I see blood, but that particular specialty just does not appeal to me. It's like super bloody, and and I just, you know, and the other thing is that with endodontics, as much as I love people, I love creating relationships, I don't want to see patients over and over again, kind of like in orthodontics, right? So ortho is really cool. You have to have a lot of patience because you will not reap the benefits of your hard work for at least 9, sometimes 18 months, or even 9 months or 18 months, or even like years, right? To see that beautiful smile on someone. That's okay. If that's for you, that's wonderful. But for me, I love to meet people. I love to get to know them. I want to do a root canal, and I want to say goodbye. I don't want to see people over and over again. But you know, it's just to each his own. So, so again, there's another image of you know, doing a root canal on a dog. And then this picture in the middle was from an ADA, the American Dental Association conference. And those are a couple of my dental school classmates who were like, "Hey, Jasmine, we saw you on a, you know, we saw you on a advertisement." And so, you know, I still keep in touch with a lot of my dental school friends. You make lifelong friends. And then just kind of that image on the right, like, you know, as a military dentist, I'm a soldier first. As you can see, I'm really passionate about dentistry, and I'm here to help you in any way that I can, especially, you know, answer questions that might guide you in your path. And, but I have the rest of my life to be a dentist. So I did, and obviously I've been in for longer than 4 years. I've been in the military longer than 4 years. I ended up doing my endodontic residency in the military. And that ended up having me accrue a little bit more time. The military is not for everybody, but I'm extremely grateful that they paid for everything. And also, it helped me create a lifestyle that I wanted, right? Again, I'm from New York, but I have always loved traveling the world. And this was an opportunity for me to travel the world. But also, military is only a little chapter in my life. I'm going to retire from the military. How old am I? I don't want to tell you guys, no. But I can retire when I'm like 46. And I know that sounds really old to you guys, but most people continue working into their 50s and 60s. So I get to do dentistry, I get to do endodontics for the rest of my life. So for right now, I'm going to embrace this other part of my career, which is being in the military. And so I have responsibilities. So we provide world-class care to our soldiers, right? We basically are ensuring that our soldiers are able to focus on their mission, on their task, right, without complaining or being worried about a toothache, right? Because as some of you may know, it's extremely debilitating if you have a headache or if you had a toothache to do what you're supposed to be doing and to focus on what you're doing. So that's why we have military dentistry, is to ensure that the oral health care of our fighting force. So not only that, but I get to stay on top of my physical fitness. We have standards to meet. Talking about standards to meet, I actually am permanently disqualified from enlisting in the Army. Long story short, though, basically I'm short. I'm just little. My parents are little. I'm little, and there is a height and weight requirement to be in the military. And I actually didn't make it, and I was kind of mad at the recruiter at the time, and I was just kind of like, okay, it's not like I'm a little short, like I'm really short. And they told me, like, it was after they did hours of testing, that they kind of told me that I couldn't join the Army. And then he was like, no. He's like, you're going to be a doctor. He's like, you're an officer. It's like, we don't need you to fly the choppers. It's like, we need you to take care of people's mouth. He's like, don't worry, the dental chair goes up and down and you'll be perfectly fine. So, but it's great to, to have a job where part of my job is to be physically fit, and also to be on top of my trainings, right? So as healthcare professionals, we all know how to save lives, but I also don't mind knowing how to handle weapons and how to blow things up too. I think it's kind of cool too. So that's just a little bit about it. But this slide is just to show you're going to have opportunities along your journey to meet really amazing people. So this image, the one on the left, I was at a dental ball, a military dental ball, and I bumped into a dentist from Thailand, who I actually had met in Thailand because I had the opportunity to present at a World Dental Conference in Thailand. And again, that kind of goes back to my experience or my interest in world travel, right? So I put myself out there to have these opportunities and to be in different places. So enjoy your friends, and making these relationships and finding people that are going to help you out. Again, a couple of these are just perks, but you yourself are going to have amazing experiences and perks to whatever it is that you choose to do in your life. So one of the perks of graduating from a military residency program, at least in North Carolina where I was, is that we got to jump with the Golden Knights. So got to jump out of airplane, pretty cool. And in the meantime, my family was still growing. When I went to residency, I had 3 small children. The youngest one, it was 9 months old. I had a 2-year-old and like a 3.5 or almost 4-year-old. So, and I bring that up because it's really important to have a good support system, right? You really, this is as much fun as it's going to be. You're going to have your hard times. So make sure that you reach out, whether it's your family, your friends, your loved ones, or even, these days we have this amazing community. You have your virtual friends. You have real people on the other end of, of your messages, on the other end of you scrolling that are willing to help out, just like myself. So, okay. So pre-dental advice. Here are my pearls of wisdom for you all. Okay. So have a vision, right? You need to do you, but you also need to know what you want to be, and you want to work on being who you want to be, right? So right now you're here because you think you want to be a dentist, or you think you want to, have a career in a healthcare profession. That's wonderful. So now what, right? Now what? You need to take steps to get there, right? And no one gets anywhere by themselves, right? We all ask for help. We all get help from somewhere. So during your journey, make sure that you are humble. Some of you are extremely smart, and we love that. I love that. I love my smart friends, but be humble. I don't know that there's such thing as a humble brag, but be kind, right? So recognize that you are young and that you are naive, and yes, you know a lot of things, and you have a lot of skills and knowledge that other people don't have. But also recognize that the other people that you're talking to, that you're interacting with, that you're asking for help from, that they also have a lot of information. They also have a lot of experiences and challenges that you're not aware of or that you might not know. So continue to be kind, continue to be humble. Make sure that you have your vision board, right? So, okay, you're in high school now, or maybe you're in undergrad now. What do you need to do? What are those steps that are going to take you to where you can take the DAT, where you can have enough money to take the DAT, or where you can have enough money to apply to schools? What are the steps that you're going to take? And then ask for help, right? There are these resources, and then know that there are so many scholarships out there. Ask around. They're on the internet. Back in the day, they used to be in books in the library, but nowadays it's all on the internet. Search for scholarships, even if it's a couple of $100. Hey, that'll pay for some of your applications. And they have scholarships for everything out there. They have scholarships because you have brown curly hair. They have scholarships because your parents are from this country. They have scholarships because you write essays really well. They, whatever it is, sometimes, don't be discouraged. It does take a little bit of work, but if it's a few $100s or a few $1,000s, maybe it's worth it, especially if there's only a few applicants. You might be the best qualified and you might receive that additional money. Do personal development, right? So basically take care of yourself mentally and physically. I'm extremely passionate about this too, right? You have a body and you need this body to carry you through school, through all the challenges, through late night studies. You need it to carry you through the disappointments, through the you want to celebrate, right? We all like to go on vacation. We all want to have holidays. You want to take care of your body, right? Don't feed it junk. I think I'm talking to the right to the right group of people. Sure, Doritos are great, and soda and juice and candy, all those things, but fuel your body, right? You're gonna feel better when you take care of your body. And it's hard, right? We kind of have a lot of learned cultural things. I love food. I grew up. Food is my life, right? So, and the more food, the merrier, right? But no, you don't want to eat until you hate yourself. But anyhow, whatever that looks like. So you're taking care of your physical self, and then mental health, right? So I love to read and listen to help, like uplifting books, self-help books, whatever. Even it could be the scriptures, it could be novels, it could be action, whatever excites you. That's personal development, whatever it is that you enjoy that can kind of just give you that little break and then help you be re-energized to take care of the things that you need to do. Heart and hustle. So you want to be passionate. Find out for yourself if this is really what you want to do. Like, oh, do I want to go to dental school? The answer is yes, I want to go to dental school. Okay, what do I need to do? You need to hustle, right? You can't just sit back and go, well, yeah, I think I'm going to take a study course. You need to be on it. Like, there are so many different study courses out there, so many resources. You need to price check them. Unless you have all the money in the world, then you can just buy all the resources, but that's not effective. Find the one that works for you, that's most cost effective, right? And then finally, enjoy the journey of becoming your best self, right? I constantly have visions of what I imagined my life would be like and where I am now, and I'm extremely happy. It's not perfect. I'm not perfect. My family's not perfect, but we're doing the things that we want to do. I didn't mention it earlier. I'm board certified in endodontics, right? It's just always been my passion. I want to be the best at what I do, right? So okay, it wasn't enough for me to just to become a specialist. I'm like, okay, well, how do I prove that I'm the best specialist that I can be? And that was through board certification, right? We just want to show that next level of excellence. And so I showed a picture of the airplane there. My husband and I met in New York in college, but he's Filipino, but originally from Switzerland. And it was always a dream of his to travel. And we always wanted to have a large family. Believe it or not, having 4 kids is not a large family to him because he's one of 8. So I'm not a disappointment, but I kind of did maybe let us down a little bit because I originally had plans to kind of meet that too, but life's a little bit busy. But I live in Hawaii now, as I mentioned, and I am not only an endodontist, but I am a mentor for a residency program. We have a 2-year AEGD program, which AEGD stands for Advanced Education in General Dentistry. So after dental school, either you can go straight and become a dentist with having done minimal number of procedures that qualify you for getting a dental license. Happens all the time. That's totally fine, but you're going to do continuing education to continually improve your skills and your knowledge. Or there's some individuals who are like, oh shoot, like I need more experience, I need more guidance, and they will go to residency programs. Another one is called a GPR, General Practice Residency. Again, they usually have those for 1 or 2 years. The military has them as well. So here on Oahu, we have a 2-year residency program. So basically our dentists, so they all went to dental school. They rotate around through us. So I'm the endodontist, I'm the staff endodontist, and we have one of every other specialist. And they spend 2 years with us becoming even better at at these skills. So I'm the mentor for that program for here. And also I'm the officer in charge of 2 dental clinics here. So I have a staff of about 100 personnel. that includes not only military, but civilians and contractors. So life is busy, but you can do it. I get excited about helping others, and sometimes they say if you want something done, ask a busy person to do it. I'm extremely busy, but I'm never too busy to help other people. Let's see, Q&A. So we've come to the end. I hope that I've shared enough with you, or maybe too much. I will just advance to this slide, but I'm available for any questions that you guys have.
Awesome. Thank you so much, Doctor, for the presentation. We do have some questions in the chat for you. The first question was, were there a lot of needs in the military? And I'm assuming this means like for dental professionals.
Sure. There are needs in the military, right? You're always doing an assessment, right? Like there's always someone doing metrics, meaning like, let's say you go to your family dental practice and your dentist is getting old. Someone's going to take over that practice. And so that's continually happening also in military dentistry, right? Where they look at the numbers and they go, okay, we're anticipating this many people are going to retire or get out. And that happens all the time. There are a lot of people who get out of the military after their 4 years of service. They're like, thank you very much. Thank you for paying for my $500,000 of school. And I'm ready to move on to my civilian life, which is totally fine. So they always anticipate how many people are going to leave. And then based on that, that's how many scholarships they'll usually kind of, play with the numbers and say, okay, this year we've got this many scholarships available. So there's a need, but it's still a vetted process, meaning there's an application process. I submitted my personal statement, I submitted my grades, I submitted letters of recommendation as well. So, everybody wants the best of the best, right?
And then another question was, I know you talked about this, but how did you end up getting involved in research before dental school?
So how did I get involved in research before dental school? So I actually was doing research in college. So believe it or not, again, you have an opportunity. So if you have to work to make money, you have to work to make money. And so my first job in college was actually as a mailroom sorter, right? I would sort mail into the mailboxes. I would write little slips that told people they had packages that they needed to pick up. And then at night in that same service center, I would give out pool balls and pool cues to people and all these random things. So that was my job during my first year. And then, while I was on campus, and you'll see this, and if you're in school, you'll see advertisements for different types of jobs. And I saw another job opportunity that was in biopsychology as a lab technician or a research assistant. And I was like, oh, well, that sounds a little bit better than, than what I was doing in terms of helping me sound better, look better on my applications. Like, what did I do? I was sorting mail. If that's what you got to do, that's what you got to do. But I had an opportunity to change jobs. So I started doing research. I was a research assistant. So it was cool because not only was I getting paid, but I also got to have my name put on research papers that were submitted because I was, in the clinic. So then when I looked for jobs, right, you look for those jobs that are gonna, again, help you. So I was specifically looking for a research position. And that's what I found. The person, I actually took over the research as a research assistant in Boston for another Cornell graduate. And what originally enticed me was that the research project that she was working on teeth. She was doing experiments, helping the professor do experiments on, I think it was rabbit teeth or something, but that project finished, and then it turned into bone cement as the next project. But again, looking for those opportunities, you keep looking. That's what I would say.
And then another question here in the chat was, what would you say the pros and cons of the Army are specifically?
Okay. Well, I will try to be I'll try to be brief. Pros and cons. Know that there are pros and cons to anything in life. right? So the grass is not greener on the other side. The grass is green where you water it, right? Because we can get really caught up on what's best for us. You know, this idea of like, well, maybe I'd be happy if, or I'll be happy when. No, you need to choose to be happy where you are. Especially, for example, for me, I committed to 4 years in the military. There were a lot of things that were kind of sucky, but I was like, oh my gosh, okay, well, I committed to this, so let me just make the most of it. Okay, pros and cons. So let me tell you about the cons of being in the military. Some of the main reasons why people get out, because you don't want someone to join your team if they're not meant to be there, if they don't really want to be there. So some people have a hard time being told what to do. So if you're one of them, then don't consider the military unless you're willing to change your mindset so that the military will pay for your schooling. But yeah, my life is controlled a lot. I am 24/7 military. I know I don't look like it. I still get to do girly things, be a girl, and have a family and have a life. But I have to do the work in order to do, like, so for example, to travel. I just came back from a 3-week trip in Switzerland. We were visiting family. I had a lot of paperwork to fill out to do it. I had to save money to do it, but we made it happen. But I had the paperwork. So, the Army will say, hey, you've got training on Friday. So, for example, what that might mean is we've got 4 hours of lecture or some kind of meetings that are mandatory that we have to attend instead of doing patient care, right? So for some of those individuals who again, I give you example because I can think of the cons, because this is what people will roll their eyes about and complain about is, I've had friends who did get out of the military and they're like, oh, what a waste of time. Like, I just want to be taking care of patients. I want to do dentistry. That's cool. I love to do dentistry too. But if I'm getting paid just the same, to sit and learn about being resilient or learn about, all the different army things, I'm fine with it. I will have a good attitude about it. So let me think of one more con of the military. Moving. Some people don't like to move. People are very situated. We all love our families, right? Some of us love our families more than others, and some of us can tolerate being close to our families. We love our family, but we don't need to live close to our family. And I know that doesn't resonate with some of you. Some people are like, I need to be there for my mother. I need to be there for my grandfather. That's fine. So then maybe the military is not for you. So we move a lot. I went to dental. So from New York, I went to Pennsylvania. I went to Pittsburgh. From Pittsburgh, my first duty station was in Maryland. From Maryland, I went to dental residency. Sorry, I went to endodontic residency in North Carolina. After residency, which was so hard. I think that was probably the hardest time in my life, was residency. Probably because I had 3 small children, but my husband was amazing. From there, I got sent to Oklahoma. Granted, when we talk about traveling the world, Oklahoma was not the thing that I was thinking. I literally almost had tears in my eyes. How could this happen, right? Because in the military, not only do you have to move, but you have to move where the military tells you they need to move. Sure, you get to put in a wish list, but it doesn't always happen, right? You get assigned based on the needs of the military. And so they sent me to Oklahoma to teach at a residency program there. And while my heart almost sank, again, you make the most of it. Nothing is forever, right? Even our lives, our health is not forever. We're gonna have these experiences. So we got there and I saw tumbleweeds for the first time. I was like, what are those? I thought those were all fake, in the movies and those Westerns, you see tumbleweeds. I saw them go past. I was like, holy cow, what is, everything was so flat. But anyhow, our first weekend there, we went up to Oklahoma City. We bought belt buckles and cowboy boots and cowboy hats. And we were like, all right, let's do this. We raised chickens. We just had a blast, and we made the best of friends. While we were there. And then we cried. We actually cried. We had more tears leaving Oklahoma than we did coming, because we had just made such amazing friends, because nothing is forever. From Oklahoma, I went to Germany. I lived in Germany for 4 years. We traveled all over Europe. We traveled a little bit in Asia. I went to South Africa. We went to Morocco. These are things that all this time I've been in the military. So then from Germany, after our 4 years in Germany, I was assigned here to live in Hawaii. So I could complain about Oklahoma, but again, know that things happen for a reason. So those are the cons of being in the military. Only a few of them, right? We could go on. You can always pick at all the things that are wrong in your life, or all the things that you're not good at. but you need to focus on gratitude, right? Being grateful for what you have. So the pros of being in the military, I get paid. I get paid to provide high quality care based on what patients need and not how much money they have in their pockets. And I can say this because I have had the opportunity to work in private practices. I was moonlighting in Oklahoma, and I've done a little bit here on island as well. So I know what it's like to quote unquote work for money. I don't like that feeling. I'm going to have to work for money one day, but so for example, if a patient gets sent to me and the general dentist said, hey, they need a root canal, I can do the evaluation and I can go, actually, you don't need a root canal. You just need this filling replaced. In private practice, that would be $2,000 out of your pocket, like out the window, right? Like if you tell someone, oh, you don't need a root canal, I'm not saying anything. I'm not saying anything, but I can do that. I get paid the same, right? I don't need to go, oh my gosh, okay, well, quick, let's get this eval out of my chair. Who's next, right? Because I need to make money. That's how business works. You need to create in order to get paid. So in the military, I don't have that. What are other pros about being in the military? You just have really great challenges. At least that's how I look at them. You are always put out of your comfort zone. So for example, like I said, I'm the head of a couple of dental clinics. Again, there are going to be some people who are like, no, I just want to do dentistry. Like, you're an admin assistant, or that must stink for you. Like I actually have a friend from residency who got out of the military. Military was never for him, but he rips on me all the time. And he says, how many root canals did you do this week? It's not a competition. I don't care. He has millions of dollars, but he has no time to spend it. But he's planning on spending it when he retires in however many number of years. And that's okay. We're going to be old. He's going to be old when he gets to travel the world. And that's okay. That's a choice that he made. But I want to be the best at what I do, obviously. And I would love to do more root canals, but there's a need for me elsewhere. And so that's what's really great about the military is they put you out of your comfort zone. They give you responsibilities that you're like, oh my gosh, I'm not ready for that. I can't handle that. But know that you're always given the tools to be successful. So, and it's also prestigious, right? I'm very proud to wear my uniform. I'm proud to be American most of the time, except for when you see things happening at the Capitol. But that's another story. But yeah, no, there's so many pros and cons about the military. And if it's something that you're interested, you think you might be interested in, just let me know. Be happy to have other conversations about that.
And then another question here in the chat was, how competitive is the scholarship?
It varies from year to year. Basically, it depends on the number of applicants and the number of scholarships available. So, something that I was taught as a kid is that you can't win if you don't play the game. That's what my mother told me. Because at first I was like, oh, I can't apply to Ivy League schools, or, I can't do this or that. And my mother was like, well, you're not going to win if you don't play the game. So might as well do your best and put your application in,
Yeah. And then actually a question that I kind of had, I know you said about like moving near like wherever the military needs you to go. Does that mean that you're also like required to live like on base, like away from your family and things like that?
So if you have a family, generally speaking, your family moves with you. You are a unit. You come with your family. There are exceptions. There are some what they call unaccompanied tours. It's very rare. But as far as living on post, I have never lived on a military base, and that's by choice. There are some places, there is actually, there are multiple bases in Germany, and a couple of them require you to live on the military installation for different reasons. But my husband and I, we make a really great team. We don't get to choose where we live or where we move with the military. But once we get our assignment, he chooses where we live from there. Like he chooses the house. I mean, of course he asks for my input, but ultimately I know that, like, for example, we live on the beautiful North Shore of Hawaii. And I will tell you that I kind of put up a little bit of a fight, and I was just being a little bit dumb about it. And I was like, so my windows are closed right now, but we live right near an airstrip where there's usually parachuters. Like you'll see them all day long, but right now with COVID, it's a little bit slower than usual. But it was freaking me out, even though I myself had jumped out of airplanes. I was like, ours is very controlled. In the military, I'm not saying it's perfect, that there aren't mistakes or accidents that happen, but they do happen. But that's why like they're so rigorous with their stuff. And it just seemed like these parachuters were having way too much fun and going way too fast. And I told my husband, I was like, I can't live here. I was like, it's gonna give me anxiety or whatever. But no, we've never lived on post. We always want a local experience. So when we search for houses, we always look around, and if there's any other military people, he doesn't want to have neighbors that are military. We don't want to live on a base where I work, eat, live, sleep, shop on the military base. So when we lived in Germany, we lived in a German home on the economy. So German neighbors shouting at us for being loud Americans. So yeah, so that's been our experience.
And then another question was about, so right now, because you are in Hawaii, is the military basically funding where you live, or that's all from like your job?
Yeah, so it's a good question. So in the military, you get a salary. And then, with your years in service and then different qualifications, like for example, being board certified, we get a little bit extra money per month. But so if you live on base, the military pays for your housing. Everything is included with the exception probably of like cable and internet. And I know that because when we first arrived here, I have some friends who actually kind of switched places with us. They went to Germany and we came to Hawaii, but when they're in the Air Force, and when we got here, we went to their house for dinner, and their house was freezing. It was freezing cold. Their air conditioning was like turned way up. And, I guess if you're not paying for your utilities, you don't care. But that was really uncomfortable for me. I was like, I didn't come to Hawaii to freeze. We don't have air conditioning here, but we have a really nice breeze normally living up on the North Shore. I see whales from my window. I mean, it's, you make the best of it. This has been a dream of mine. I always wanted to come to Hawaii. Actually, when I was in dental school, I went to the ADA meeting. Actually, I might have gone to I was a ASDA, American Student Dental Association representative. And I happened to meet someone who was in the military. And I went up to them and I said, oh, I'm in the military too, which meant nothing to me because all I knew was that they were paying for me, but I had not had any military experience yet. And they were like, oh, well, you should come to Hawaii. We have a training program. And so he was basically inviting me to do a little bit of shadowing over here before I graduated from dental school, which was totally possible. But, ever since I learned that Hawaii was an option, I was like, I want to go there. I want to go to Hawaii. It took me over 10 years to get here. So it's not like, I just get to go to Europe and I had to work for it. But when you create when you have good work ethics, when you create good relationships and you prove your worth, sometimes the doors that you want to open will open. So, yeah.
And then another question is about your traveling. Where is your most favorite place that you've ever lived?
Oh, okay. So people have asked us a lot, like, would you rather live in Hawaii or would you rather live in Europe? It's really hard. They are extremely different. My husband and my kids are Swiss, like their dual citizenship, right? So they carry both passports, but there's something very special about world travel, especially living in Europe and knowing that, especially in our culture as Americans, sometimes some people can be a little bit pompous, thinking that, like, America's great. Otherwise I wouldn't be, serving my country. But this idea, like this, like, we're number one type of mentality. Sure, we are wonderful, but there are really amazing other people and cultures and organizations around the world. So it was very humbling in that sense. And also the food is amazing. Here it's kind of funny because you might find an establishment, they're like, oh, open since 1981 or something like that. So old. No, like in Europe, things have been around since 1200. Or like, the Colosseums in Rome, the Colosseums in Rome and stuff like that. Like, holy cow, world history was so amazing. But also, living here in Hawaii, I absolutely, I have a Hawaii dental license, and this is someplace where we could consider coming after we get out of the military. very laid back. I love the climate. I love the people, love the food. It's for other people, it can be very isolating. Let me share something with you. There are some people out there who will complain no matter what or where they are. You will have people who have lots of money and they will complain. You'll have people who have every advantage to them and they will complain. Something that surprised me a lot was when I was in processing through the military, and I arrived on island, and I was like so like in awe. I'm like, totally jet lagged. We had just come from Europe. I hadn't slept for like almost a whole day, but I was still, with this huge smile on my face and just, sweating because I was like in my uniform, but I was still smiling because I was so excited. And then I turned to the person to my left and I asked them how they're doing, and they're like, I can't wait to get off this island. All right, so there are people who are gonna be unhappy no matter where you put them or what, so don't associate yourself with those people. Actually, one of my pearls of wisdom, I didn't mention it because I guess I forgot to prompt myself, was surround yourself with people who uplift you, right? Whether you're in high school, whether you're in college, or especially when you get to dental school, because you'll be in a new environment with people. Find your niche. Find people that you can be yourself around, and people who make you happy and who are interested in the same things as you, specifically like doing well in school, who want to do study sessions with you, but also want to have a good time, right? You want to associate yourself with those people who are going to uplift you, because there's plenty of negative Nancys out there. Life is hard. Life is hard. I mean, but you can make it fun. But yeah, it's hard to say where would be my favorite place to live. I'm from here. I would love to go to Asia. I'd love to go to Japan or Korea, but who knows? I could get sent to Louisiana, but I will be okay if that happens, because I am who I am and I have the mindset. But we'll make the most of whatever happens. But in the meantime, I'm going to work hard towards what I want and make the most of wherever we go. And I hope that you guys do too.
And then another question was about how you mentioned you joined the Army because it was like more approachable to you. But what are kind of the differences in the branches?
Okay, that's a really great question. So the Army is the largest of those three branches that I mentioned. So the Air Force and the Navy, which just happens to mean that there are more opportunities because there are more people. So there are more residency programs, there are more slots. Having said that, though, some people have legacy, meaning like maybe you come from a family who was in the Air Force or was in the Navy. Those are really great branches too. So actually what that means is the Army has more scholarships available because there's more people. There are also residency programs in the Navy and in the Air Force. So it just depends. But the other thing to consider is also location, right? So if you're in the Navy, you're going to be on a ship, or you're going to be on the coast. That's not true. I guess I have some friends who graduated from Michigan. In that their endo residency was there, and also several of them were getting assigned to Japan, and they didn't want to go. And I was like, why? I was like, what's going on? I want to go. Me personally, there's always going to be limitations. It's going to be a challenge for me to get to Japan. Again, I'm extremely dedicated to my profession in dentistry. This is my life. This is my livelihood. Like I work. My husband is an amazing at-home dad. He has a degree from Cornell in economics and finance, but he decided it was more important for him to spend time with the children versus working and paying someone else to spend time with our children. And I'm totally fine with that, but I recognize that I carry our family. So dentistry is still very, very important to me. But we also love family experiences and travel. So there's no endodontist slot for the Army in Japan. So the way that I have to get there is through an administrative position, like as a commander. So that's why I'm kind of bouncing around and doing things. But know that you can make things happen, right? Nothing is impossible. You can forge your path and make your career. So just one more comment about the differences between the different services. We have a little bit of banter that goes on between the Army and the Navy, the Air Force, the Marines. We're a bit more hardcore. We in a playful manner, we make fun of the Air Force. Their physical fitness test is not as hard as ours. Again, don't forget, I'm really small. I didn't tell you, I'm 4'9" and 3/4. The 3/4 is really important. Nothing is impossible. So I've had 4 C-sections. You know, physical fitness, as you heard, is really another passion of mine. And I like being the strongest version of me that I can be. And but anyhow, yeah, our physical fitness test, you know, our regulations are tougher, so we kind of make fun of the Air Force. But the locations, so that might drive someone in terms of whether or not they want to apply for Air Force or Navy or Army. The Air Force, you know, where those bases are located and that kind of thing.
And then also regarding that, what are some of like physical fitness requirements?
Okay, so there is a physical fitness test, and so there is a height and weight requirement, right? No, height and weight. Yeah, it's really funny. They measure our height all the time, and every time I move to a new location and they measure me for the first time, they like look at it again, and then they look at their chart and they're like, "Ma'am, you're not even on the chart." I'm like, "I know," because I think it's funny because like it's not like your height is going to change, but what it is that they have a height and weight chart. So basically, I should not weigh 400 pounds, right? And so that's kind of what it's used for. But so you know, we need to have a certain presentation to ourselves in that standard, but then we also have tests. So they just created a new, it's a new fitness test, and basically the core of it is to see that we can still do tasks that would be required of us if we were deployed. So for example, there's a number of events that we do. So one is a ball toss where we toss things over our head. Then there's another little sprint, we call it a drag carry sprint or whatever, where we're holding 2 40-pound kettlebells, which is almost how much I weigh, 2 40-pound kettlebells, and we have to sprint and then turn around and come back. We have to do push-ups a certain way, and then there's a 2-mile run, there's leg tucks, and each of these things corresponds to like, hey, can you carry an ammo can? Can you push your partner over a fence? Can you can you lift up a casualty? Like if your buddy is down, can you lift them up? So that's the core of these things. Obviously, as a dental professional, we are not on the front lines, right? That can sometimes be a concern for people about the military, is like, oh my gosh, so what if I get deployed? It's part of our responsibility. How often does it happen? Actually, not that often, but I have friends who have deployed. They went to Iraq, Afghanistan, and a lot of other places. I mean, people get deployed to Poland or to Africa for different missions. But if you're getting sent there as a healthcare provider, you're doing healthcare, you're providing dental care, right? We're making sure that our team members are getting taken care of, because they can come up with toothaches too. Or sometimes we do humanitarian missions and might serve the local population and take care of some of their needs and extract teeth. Sorry, I got a little off track. But yeah, so did I answer the question?
Yeah, so just to be clear, like you'll never really be in a hand-to-hand combat because you are there to do teeth, right?
We'll never say never, right? Because we are soldiers first, right? So as officers, we do carry a sidearm if we're deployed, and if it comes down to it, then you would take action. However, the other thing as a soldier first is that we're first line defense, meaning that like if a bomb were to go off, like we're not going to run. I mean, yes, we're going to assess the situation, but then we're going to run towards it to help people, right? And one of the jobs that we have, even as dentists, is to triage, right? I need to be able to I'm trained to be like, okay, that one's gone. This one, let's get the tourniquet on them. This one, it'll be okay. This one, okay, let's put pressure on the wound. This one needs fluids. How often do we use those skills? Not very often, but it's pretty cool. These are skills that I have. I'm trying to think if I get, like jumping out of airplanes, these kinds of things. There aren't very many dentists who get to do that. I'm sure as a civilian dentist, you get to do a lot of other things like set your own hours, and pick and choose what procedures you want to do. I'm trying to think of other advantages of being a civilian dentist. Like there are a lot of perks because a lot of you are going to be in private practice, and that's great. It's wonderful. I know that you're just kind of excited about my random crazy military lifestyle. But know that part of it is my personality, because like I said, you can put people in the same position and they're going to complain, right? I have colleagues who complain. It's really hard for me in my position, overseeing a dental clinic, because I'm everybody's boss. So it's hard in the sense that, like, in the military, it's different. Like we have, I mean, it's not different. Like when you have a job, you have a job, you need to show up on time. You need to do your work. It's kind of the same here too, but sometimes people, I don't know, everybody wants to work less, right? So like when some of my doctors are leaving the clinic early, I'm like, hey dude, like what time is it? Like we're not allowed to leave until 4:15. And even then people will roll at 4:15. Really? Is it that hard to stay until 4:15? But the waves call. People like to surf around here. So.
And then just two more questions. So does the military include all specialties in dentistry or just a few?
That's a good question. So we have every specialty. Some of the training programs are actually civilian. So there used to be, they used to train 8 of us in the military, like endodontists in the military per year, and 1 in a civilian program at the University of Iowa. I have a friend who went to the University of Iowa. They don't do that right now for endo, but I do know that pediatrics and pediatrics, it's a civilian program, I believe, in Texas. There's a few of them. And then they kind of like outsource. They have these built in. Yes, there's OMFS. There's multiple OMFS. There's even an opportunity to have 6-year, like where you get your OMFS certification and you get an MD. And what was I going to say? There's something called tri-service. So there's actually a couple of residency programs where there's Army, Air Force, and Navy residents. I know specifically there's a PROS residency like that. So yeah, every specialty.
Awesome. And then our last question for you is, what is your favorite procedure to perform?
My favorite procedure to perform. You know what? They say root canals are the bread and butter of your practice. It's not always easy, but I like simple root canals. I love doing surgery too, but my favorite procedure is non-surgical root canal therapy. Basically, I love it when patients, came in and they've been distraught. They've been experiencing a lot of discomfort, and I can take care of it for them. Almost instantaneous, depending on the type of infection. But yeah, and just a couple of caveats. Just want to share. I know that there were a lot of questions related to military dentistry. Just want to encourage you guys again, in regards to the pearls that I gave. Ask for help. You're doing the right thing by listening and asking questions. Plan out your course of action. Understand and be prepared for it to deviate, and know that there are going to be bumps in the road, and that's okay. Sometimes you have to go through these challenges, and that's what's going to make you stronger. And what else? So as far as getting into your healthcare, making sure that you're passionate about it. Know that your journey looks different than everybody else's. My journey looks very different than everybody else's, obviously, but you can create the life that you want. Nothing is impossible. You just need to hustle. You need to hustle, and really that's, you need to know that that's what you want. And I know here on the slide here, again, that's my IG handle, and I'm always available, whether, for dental advice, but also know, that you have, you guys already know this, you have so many resources available to you, and probably a little bit more, like if you're looking specifically for dental advice as in terms of studying for the DATs or what resources to purchase, probably asking someone who is a little bit, who's done it more recently would be a little bit more advantageous. But having said that, feel free to reach out to me. The other thing is, of course, if you need to become mentally and physically stronger, feel free to check me out for some motivation or for some resources as well. I'd really like to say thank you to Hannah again for reaching out to me and giving me this opportunity to talk to you guys. And again, just look forward to any other questions that you might have, and you can reach out to me, as needed.
Thank you so much, Dr. Jasmine. Just stay behind. Guys, you can go ahead and thank Dr. Jasmine in the chat. There's a post-session quiz also linked in the chat and in our link tree on Instagram. You can click the bio. Yeah, this will conclude our session. This session is